I'm Georgina Hall, and this is the Phemale Empowered Podcast, inspired by the casual conversations I've had with thousands of women over my career in coaching. This is not just another wanky women's wellness podcast. We are bringing the uprising. Hi friends, welcome to the Phemale Empowered Podcast. I am your host, Georgina Hall, personal trainer, offerer of opinions, and today I'm talking to Rachael Moses, who is consultant respiratory physiotherapist and associate director at Royal Brompton and Harefield Hospital in London. That's a mouthful, Rachael, isn't it?
Isn't it just?
So you're going to have to explain all that to us, Rachael. You're going to have to tell us a little bit about yourself and what that job title means.
Well, let's start with the job title, so the consultant bit. I think in healthcare, people genuinely grow up, don't they know what doctors and nurses are. You see it on the telly, you see it in casualty, you might get dolls, and they generally don't know about the different aspects of healthcare unless you have an injury, unless you have needed to see a physiotherapist or an occupational therapist or a speech therapist. So we don't have the typical career pathways as, say, doctors or nurses would. But over, say, the last 10 years, we've been developing extended roles for people like me, like physiotherapists, to achieve the same level of clinical skill and ability that, say, a doctor would. So the title consultant respiratory physiotherapist means I'm a physiotherapist by background, but I'm trained to a consultant level, so a senior level. And with that comes the clinical skills. So respiratory, obviously, I deal with people who have breathing problems, who are on ventilators, who might need ventilators at home to help them breathe. And obviously in a respiratory pandemic, that means people like me being quite busy. So that's what it is. And then I also sit in a senior leadership role within the Royal Brompton and Harefield here in London. And I have a few other strings to my bow. And we connected through Alex, who's an advanced critical care practitioner. That's something completely else.
She's another NHS hero.
Absolutely. And she specialises in critical care as an extended scope practitioner. So that's what it is. It's a pretty awesome job, I have to say. I'm so privileged to work for the NHS.
And I will say, on behalf of all of us, thank you very much. You've said yourself, respiratory care. I imagine you are pretty busy at the minute.
Yeah, but it's all good. We're just one big team, isn't it? And all frontline, isn't it? It's everyone, all key workers. And I've been doing a little bit of research about you as well, and the work that you're doing around empowering women and just everything around health and well-being, around fitness. I mean, your WhatsApp picture's insane. I was like, combination of drooling and really angry. I was like, why the hell don't I look like that? And I'm like, oh yeah, that's because I don't exercise like 5 hours a day and eat vegetables.
Thank you very much.
Well.
I would say that I don't look like that anymore. And I would say that I am doing my best, but I wouldn't class myself as an essential worker, and therefore I haven't qualified for an influencer trip to Dubai.
I've seen that snippet, everyone doing the rounds.
Where was I when then trips were getting handed out?
You were clearly personal training and group training all of these wonderful frontline key workers that I hear you've been doing fantastic work with. So that's it. I
was busy doing my job. Not like you though. Tell us a little bit about what's going on, because you're in London, right? So our mutual friend Alex is up here in Newcastle upon Tyne in the RVI on ICU. Tell us a little bit about what it's like down there in London.
Yeah, so we're recording this podcast on the 27th of January, and yesterday we unfortunately hit our peak number of deaths. Over 100,000 people sadly lost their lives due to COVID, and we're in what we call super surge down here in London. So we are in super surge of our critical care beds. That's people needing ventilators, and it's really just all hands on deck. So we're working every hour we can safely. It is above the normal hours would work, but also we have a huge amount of volunteer support as well. So we have people coming from all different backgrounds, dentists, we even had some vets working at some point as bedside workers to really just help out. Yeah, so people who you think like musculoskeletal therapists, osteopaths, chiropractors who can provide some kind of support inside the intensive care unit and therefore support the nurse, because obviously, if you've seen from the media, we've got a real shortage of critical care nurses who really are the ones that keep the patients alive. So that is literally all hands on deck. It's an incredible team effort, and we're so grateful of the cleaners, the cooks, the caterers, everybody. I know it sounds dead cliche and naff, doesn't it? When you say it, you're like, oh, but it's so true. I can't tell you. So yes, it's really, really shit. It's the shittest time in my entire 20-year career, and I've been in the military, and I've done humanitarian work, and I've done disaster work. Nothing quite compares to the relentless, continued, effort we're putting in now. But yeah, try not to be too negative and sad. There's loads of positives as well. But most importantly, just try now to flatten that curve, to save lives, and also prevent further people from getting COVID.
Absolutely, and we'll come back to that slightly. I can see your NHS rainbow in the background, or it might be an LGBTQ rainbow, I don't know, but it has got NHS rehab legends next to it, so it could be either. So positive, you got clapped every week in the first lockdown. That must have been nice.
Well, do you know it was, but in all seriousness, it's like at 8 o'clock, it was like handover time. So unless you want to
Alex said the same thing.
So you were kind of like, but I've been around a bit, I'm always in one. And you can, in some of the units I worked on, you could actually hear it. You could hear the echoes like across London. And I remember going home for the first time in about 2.5 months back to Newcastle. And my husband standing on the doorstep, and I was like, what are you doing? He's like, going to do the clap. He's like, are you coming? And I was like, oh no, I feel really cringe. And he was like, but it's with people like you. And I was like, no, so it was just really surreal, but it was a tremendous effort. I mean, do I want the clap back? I think the general consensus is no. But the first time around, it was so lovely, and all the rainbow like pictures that we got from kids, and yeah, so that was lovely.
That is nice, but also just, you probably prefer people to stay at home and do what they're told?
Absolutely, completely.
So I'm just going to go back a little bit, because what you said about humanitarian work just rang a little bell in my head. I read an article, and I'll have to find the correct author and link to it in the show notes, but it was about your surge capacity has been depleted, and that's why you feel like shit. And that was in the first lockdown, and it was about how we're kind of in the middle of a crisis, and if you imagine a tornado is blasting through where you live, you still try to clear up the mess that the tornado has made while the tornado is still going. And that's a little bit like what this COVID pandemic has been like. From a humanitarian perspective, can you resonate with that and the fatigue and the drain that it's kind of caused?
Absolutely. I think that when you're faced with a crisis, we'll talk about crisis leadership, you have to remain calm and collected. And in terms of how much information you want, is often exceeds the information that you need. So you've got to be very mindful of the cognitive load, because you're preparing something or someone or teams for a process you don't know how long it's going to last. So the first part of that is preparing yourself, preparing your workforce, preparing your team.
And people can take from this now, can't they? Like, we've just had the news today that your kids aren't going back to school until the 8th of March at least. So people now at home who are just listening to this, they're working from home, they're homeschool and all that, they can take this on, can't they? So write this down. First step, preparation. Rally the team round, the kids, the husband, rally them round, prep.
Then you've just got to have very clear objectives, and they just need to be really, really simple. Everyone needs to know their role and responsibility of what they're going to do. So, if we're related to homeschooling or anything, it's about being realistic with that as well. There's nothing worse than setting things that are unrealistic or too high, or putting your expectations too high, like lots of people did in the first lockdown, I believe. It's about just trying to keep not so much the fun element, but when you achieve something, you get a sense of something, don't you? Satisfaction, relief, praise. And sometimes that drives people for the next things, because everyone's driven by different things and everyone adds different values to different things in the same thing. So it's understanding what that is. And then it's kind of like, how are you going to achieve that? So it's all well and good saying, oh, we're going to do 3 hours of maths every day, but like, how are you going to do that? Who's going to, it's the step-by-step process that you need to think of, because there's nothing worse. You set yourself up for fail if you do the planning bit and you do the outcome bit, but you don't actually know how you're going to, apply it.
Yeah.
And then there's the safety net. So it's like, what happens if that doesn't work out? What happens if that's not achieved? What happens if you don't hit that goal or milestone day? What happens? And I think sometimes, predominantly as women, being the feminist that I am, I think we are always a bit harder on ourselves than our male counterparts. And I think we also, and this is where we get in this cycle, and this is where I particularly like some of the stuff you do, because you think, like if you've had a really bad day and you eat like 15 chocolate bars and you're like, oh, fuck it, just tomorrow I'm just going to have like 25 bags of crisps because I had 10 chocolate bars yesterday. It's like we're falling into that mentality, don't we, where we're just thinking, you know what it is, that was a bad day, I've done that, but tomorrow's another day and I'm going to address it this way. So it's, what's your safety net if things don't quite go how you planned them? It's all right. It's all right, it didn't go how you planned, because there's a reason for that. It doesn't matter. Let's move on. And that's probably one of the biggest lessons that I've learned during the last 11 months. Because being a high achiever, being someone that always wants to, tick the box or get to that milestone, or, I think I've realised that it's okay. It's okay to not quite get there or not quite do it in that time frame.
Or as well, maybe you're not motivated. And I think that my general feeling from clients and people that I spoke to in the first lockdown was there's a lot to do. And like you say, people kind of set themselves up to fail. So people are going, right, well, I've got time on my hands, so I'm going to learn a language and I'm going to get fit. I'm going to come out of this with a 6-pack and I'm going to learn an instrument on YouTube. And then they were like, oh shit, actually, I've still got to work. I've still got to look after my kids. I've still got to do this. And actually, I can't be asked. Right, well, let's just not set ourselves up to fail. Then the second lockdown came around and we were all like, oh, well, it's okay. It's nearly Christmas. We'll just put the tree up early and we're all right. We'll start eating now. And then this one's come round. It's a third lockdown. It's January. Christmas been and gone. It's too cold to go outside for a run without going arse over tit. And people can't be asked anymore. And it is, I've just got the general consensus around people that I'm talking to of not being asked, which is why, of course, I joked at the start, but I just can't see anything less motivating than somebody in Dubai doing home workouts.
Absolutely. Do you know, I think that we are so fortunate. Any key worker is actually really fortunate as well. And I say that because we have that motivation, we have that goal, we have that, okay, we need to go to work today because other people are relying on us. And I really feel for people in the hospitality sector, people like yourself, people who drive business on public and people on interactions that they're not allowed to do. Yes, you can do it in a digital way, and yes, you can do it in other ways, but it's not the same. And for us, in some ways, it's easier because we have external drivers and external motivations, and we have a purpose in life. Now, that's to say that people who work from home don't. Obviously, I'm not saying that. It's different, isn't it? Because you have to get dressed. You can't sit on your Zoom and wear your pajamas. I mean, my friend wore the same knickers for 3 days. I was like, 3 days? I was like, oh, well, I wasn't moving, so they didn't smell that much. I was like, 3 days, but have you got no self-respect? Like,
yeah, come on, even I wouldn't do that.
She said it's just what happens because you fall into there. You take your clothes off, you put them on the chair, on the bed, and she said it's just this trap you fall into. And I was like, God, I couldn't relate to that because we're having like 17 showers a day. Yeah. So yeah.
My girlfriend's like that.
I don't even know how we're talking about knickers already.
I better not tell anybody what the actual situation is because she's got a proper job. But she came in this morning, she had
floral pajamas, bottom half, and then top half she had a proper top on, a jacket, she'd put a necklace on, done her hair, and she was like, so does it look like I'm like official and ready for work? And I was like, yes, as long as you don't stand up in front of your camera. So I'll not say what she was actually doing because it's probably inappropriate, but I was like, wow. How much more effort would it have taken you to put proper trousers on as well there?
Yeah, no, but there's something about, it's like the rebel though, isn't it? It's something about it. It's something about, you know, you're always told by your man, put clean knickers on, make sure you have clean knickers on in case you have an accident. My mum always used to say that to us, make sure you've got clean underwear in case you get knocked over by a bus. But
I have to say that throughout the whole year, at no point have I thought, oh my God, I better change my underwear tomorrow. I've been pretty hot on having clean pants on. Despite everything.
There's something about just being naughty. It's like, I think that's where, you know, we talk about looking after our bodies. You know, this is where having a gin and tonic at 11 o'clock in the morning, this is what a lot of people fell in the trap of doing, isn't it? And they were like, because they could, and they would, you know, have no foods that they wouldn't normally eat through the week because you had no weekends anymore.
Beers with Boris.
And it was convenience. Yeah.
Do you remember when we first went into lockdown and we thought it was going to be 2 weeks? Oh, bless our souls. And it was like a 2-week holiday. So I was just like, yeah, and I'm going to treat it like a holiday. And every time Boris did the 5 o'clock briefing, I did a drinking game along with it. And it got to, and I was like, I can't keep this up. When it became obvious that, no, this is our life now, I was like, I'm going to have to knock this game on the head, and I'm really going to have to cut back the alcohol because I'm not on holiday. Not for the next 9 months.
Oh, wow. No, but yes, I can only imagine.
But if we go back to, well, we're not really going back to, we kind of can't really move away from COVID right now. So what I would like to ask you as an NHS professional, as somebody who specifically works with ventilators, respiratory diseases, what do you think to people who think it's a conspiracy?
Oh, I mean, there's started to be some media footage, hasn't there, inside intensive care units. So if we look at the statistics, so 30% of people who contract COVID, I think it's over 30% of people will have no symptoms at all, so will be completely asymptomatic. Then you have 55% of people who will have symptoms, mild to moderate symptoms. Then you have 10% that require hospital admission, and you have 5% that are going to be critically unwell that could die. And of course, as we know, many do, because we've had over 100,000 deaths. Yesterday's data showed we have over 4,000 patients in the UK requiring ventilation, so tube down their throat to help them breathe, that could die because I had COVID. So people that deny, I think, look at the statistics, number one. There's people that saying they make it up, they put on the death certificates. It's just not how the law works in Britain. It's just not how it works. I wish we could.
Well, what I think, because I do actually have a friend who thinks that, like, she knows that COVID is real, but she's not really accepting of the severity, is what I'll say. And she does kind of think that kind of thing of, well, some death certificates are just changed. Why are they writing COVID on death certificates that they haven't died of COVID? And I like, do you realise how many people would have to be in on that for that to be the case?
Yeah, and there was some conspiracy theory that the doctors got more money for COVID on the death certificate, which was absolute rubbish as well.
Like you're on commission?
Yeah, like they're on commission for it. It's just absolutely rubbish. I mean, I can't tell you how this has affected everyone, and it's like, how can you show genuine people in the intensive care unit and on the respiratory ward with COVID? Like, how can we ethically do that? But it's real, it's out there, and I think the turning point is often when someone has a family member or close friend that either gets COVID and gets ill or very sadly dies. I think that's when people change their mindset.
Yeah, I think I would probably agree. So I don't want to spend all of our time on COVID because I think probably people are hearing enough about that in their general life at the minute. But there have been a couple of things that you said where I've been like, oh, let's break that down further. So you said that you're feminist, and I have got that on my notes about you as well, feminist. So I would love it if we could spend some time picking apart the patriarchy. And I did briefly mention to you in our pre-chats that I would like to talk about patriarchy in modern medicine.
Yeah, so if that, do you mean typical, like everything's set up typically for men to achieve more, that things are geared more to, male doctors and that gender stereotyping? Is that kind of where you're going with that?
Actually, no, but we can go this way as well. I was coming at it more from an angle of patients.
Okay.
I did a survey about almost about patriarchy in, say, things like menstrual cycle, or women going undiagnosed with polycystic ovary syndrome, anything like that, where they've gone undiagnosed because of I'm just being careful what I say, can you tell? Patriarchy. I'll give you, and then it doesn't matter that I say it, I'll give you a personal story. So people will love this insight into me. I used to bleed for 3 weeks out of the month.
Oh, wow.
And when I went to the doctors about it, I kind of got the vibe that it was a bit like, oh, that must be a bit inconvenient. You're going to have to just buy more tampons, aren't you? I'm like, well, it's not just an inconvenience, is it? But you wouldn't understand that because you haven't experienced it. So that's more the patriarchy in modern medicine vibe that I was going for.
Okay, no, that's true, and it's societal as well. So it's, you have male patients that maybe shout more, or they're louder, or they're more assertive, or they demand more, and therefore they get more. And there's you can bring equality and diversity into that. You can bring ethnicity into that. You can bring sexual orientation into that. There's so many levels to this. I think probably if I was going to give you an example of that, I have a really good friend who's a fanny physio. She's not really just a fanny physio. She's like everything. She's pelvic health, but
Is that her official job title? Is that what she's got on LinkedIn?
Well, no. What she says is she fishes about in fannies for a living. And she's Scottish, so it sounds even, you'll have to get her on here. She's called Gossip Grippers on Twitter for anyone that's
right. Well, I'm gonna write that down.
She's a stand-up comedian as well, so she uses comedy to educate. So 1 in 3 women leak, so they leak urine. They basically piss their pants to some degree, and it's such a taboo subject that no women feel like they can't talk about it because it's dirty and it's disgusting, and mainly men won't find them attractive if they dribble a bit of wee, when they laugh, when they sneeze, when they cough, when they need the toilet, when you put the key in the door. So would you go to your male GP or even maybe your female GP and say, this is my problem? The thing is that 80% of these cases are treatable by physiotherapy, from a pelvic health physiotherapist, with very simple exercises. But what happens if you go and see, again, I'm not generalizing here, if you go and see a male GP or male doctor, is they'd want to give you surgery to fix it because they can fix it. So whereas actually referral to a specialist physiotherapist, where we know this, it's even higher than 80%, it's like 84% effective or something, a 6-week course of exercise therapy. And it's so common after childbirth. I mean, very few people tell you to do your pelvic floor. Yeah, do your pelvic floor exercises. I mean, I'm doing mine now. Don't. Can you tell?
As soon as you started saying pelvic floor, I was like, squeeze, squeeze, squeeze. Everyone will be doing them now.
That's exactly it. Quick flick, squeezing. It's this is where I do think it exists now. The reason why I think we're in a time of change is because within modern medicine, you do have people like me, and lots of people like me who are feminists, who are self-proclaimed feminists, and who stand up and what the one is equality, and the one equality and equal access for all. And we talked about my role at the very beginning being a consultant level, and that sends a message out to say, you know, women like me, you know, can achieve the same levels as men like you in that field. So I think the times are changing, but, you know, does it exist? Of course it exists. Is it wrong? Yes, it is. How we're going to break these barriers down. It's about having role models. It's about talking about stigma. It's about talking about taboo subjects. You know, we mentioned It's a Sin. That is a classic example. You know, how many millions died of HIV and AIDS, and now
just for background for listeners, we talked about It's a Sin on WhatsApp beforehand. So to catch the listeners up on that, It's a Sin on Channel 4. I was saying to Rachael that I watched it at the weekend, binge watched it all, and something that I couldn't stop thinking about afterwards was how many homosexual men died unnecessarily, and how much quicker something would have been done about it had it been heterosexual men dying at that rate. And I couldn't help but compare it to COVID, in the fact that if it was young people dying at this rate rather than, you know, statistically older population or people with underlying health conditions, so more, it would have been handled differently. More would have done about it, would have been handled differently. So the fact that certain groups get to almost decide the worthiness of lives based on age, gender, sexuality is unbelievable. And it was in the 80s. It's a Sin was in the 80s. It was the late 80s, early 90s. Was it Freddie Mercury died in 1991, right? That's very long ago.
Well, this is why we have the protected characteristics now, and this is why we have the Equality Act, which, to be fair, isn't fit for purpose, but that's a whole other story in itself. But yeah, I mean, I completely agree. Healthcare inequalities, and again, not fixating on COVID, but what COVID and Black Lives Matters has shown us is the extent and the reach of healthcare inequalities, not just in the UK, but globally, but without a doubt in the UK. And the Public Health England disparity report, on top of everything else, on top of Marmot reports, on top of everything we knew, you know, like, if this has to be a time of change, doesn't it? Like, there is now too much evidence, and people have a voice that never had a voice before, and people are listening. And we have more activism, and what we need to do is control it, and we need to have meaningful action rather than just empty words. And that's one thing the government are going to be held to account about, and if by anyone, by the National Health Service, once we regroup. And healthcare inequalities will be massive in that. You know, if you're a male living in a sort of deprived area, you know, and we'll talk specifically about lung disease, you will die 9 years earlier than someone that is from an affluent area. You know, because you're much less likely to smoke, you're much less likely to have air pollutants and occupational exposure, you're much more likely to have a really crap diet, and you're more likely to get a better education and therefore employment. So we know that those statistics have been around for a long time. So yeah, got to be time for change.
It's mad to me, and I know that you've done a lot of work for equality within the NHS. Correct me if I'm wrong, but equality on employment interview panels?
Yeah, so we've done a little bit of work around that. Basically, we run a series of podcasts that are on YouTube, free access. We don't obviously get any money or anything for them, but it was around how we can change the culture of conversation within healthcare.
Go on then, promote them.
So it's just on YouTube channel, AHP Leader, but it's a panel of people. The panel's all made up from people from ethnically diverse backgrounds. I am the only white member of the panel member, and it was obviously very purposeful. So we talk about how we can have open, honest and transparent conversations and reach out to people from minority backgrounds, and really just starting to change how we think, how we address microaggressions, how we address racism, where you know, it's embedded throughout the National Health Service, unfortunately, systemic racism and oppression. And so that's what we started to do, and those conversations have followed, and they've led on to things like how we recruit people. I mean, I had a massive realization, just as a kind of disclosure and a bit of honesty from me, that I went to do a job in St George's after leaving Newcastle. Obviously, there's that about 10 years ago, we didn't have much diversity in the workforce in Newcastle. I probably still don't. But I went to work at St George's, and it's a very multicultural part of London. And I was managing people from all different ethnical backgrounds, religious backgrounds that I've never managed before. And I had this realization one day when I was interviewing that I'd only ever employed people that look like me and that are like me. And I was like, oh, they're not confident enough. Oh, they're not loud enough. Oh, they don't present themselves like this. And I just sat there and thought, oh my God. And I swore to myself the next interview panel I done, I would give someone a chance, and I did. And it's really hard to do, actually, when you want to base an interview on cultures and values, because we're so used to just asking like the medical questions. And you know what an opportunity that it was a young female woman at the time, and we're still friends now. And so that was a realization for me, because I grew up in this very British stereotypical environment, and was never racist, but I was definitely not anti-racist, and I definitely didn't level the playing field, and that was the difference for me. So this is again where this whole, I've been on my journey for about 10 years now. So yeah, it's been a real eye-opener.
Yeah, it's interesting because it is so ingrained that we don't even know. The BLM movement, especially last year, 2020, I'm the same as you. When we posted the fucking black square on Instagram for a day, I went, right, what does this mean? I don't want to just post a black square like everybody else is doing. What does it mean? What do I have to do? How can I be better? What books can I read? What can I learn? How can I be an ally? How can I be anti-racist rather than just, I'm not racist? Because that's a cop-out.
Yeah, and when you're in positions of senior leadership management, that's when you have to be very clear on what you stand for. And you're representing a workforce, and you need to represent the diversity of that workforce. And if you lack diversity, you need to start asking intrinsic questions about why you did, and that's what I've done. And it's uncomfortable truths. It's the uncomfortable truths. And it's not about blame. It's about the fact that we've been brought in with ignorance. I mean, look at what schools, man. You learn English. We go to France, we go to Germany, like, parlez-vous anglais? The first thing you ask is, can you speak English? And it's like, some I've got loads of friends who won't even attempt to learn yes, please, no, thank you in that native tongue wherever you're visiting. I mean, but yeah, we expect everyone to come to our country and speak English. And if people don't, so in the hospitals, and you have, say what Filipino nurses will default back to mother tongue if they're in the staff room. And I've had my members of my team in the past saying, oh God, it's so rude, they're speaking in their own language, or they're speaking about work. And I said, right, can you imagine the cognitive load if you constantly speaking in a second language when you're at work, when you're concentrating, when you're writing? If they're having a break and they want to switch off, and they've got someone that speaks their first language, they're not speaking about you, believe me, that's your own insecurity.
Yeah,
that's a microaggression though. That's a microaggression, and that's not recognizing someone's cultural or ethnical needs. So it's about explaining that side of it as well.
Yeah, you're so right. And I guess that a lot of people, once you say it, will go, oh shit, yeah. But it is exactly, I'm a big believer that if something triggers you, you've got to ask yourself why. It's what I've learned from therapy. Top thing, don't worry about what someone said about you, worry about why you're bothered about it. So if you sat there thinking, well, are they talking about me? What are they saying? Maybe you've got to do a little bit of deep diving within, hon.
Absolutely. It's like, that's fucking interesting, honestly.
Yeah. No one cares what's in your sandwich. Yeah, I've had that as well though. I was walking along one day in York, actually. Me and my pal were walking along, and a group of lads walked past, which always fills me with dread, by the way. And one of them just went, lesbian! Like, thank you. Yep, correct. And my friend was just so shocked and astounded, because obviously she's a nice person, was like, oh my God, I just didn't even know that that kind of thing happens. Like, of course it does. Of course it does. But there's no point in me saying anything. I mean, I did shout very cleverly, dickhead, back. But what that situation requires is for all of his pals to go, fuck off, mate. Why are you such dickheads? That's not what you do. Because otherwise you just feel like you're another person with a chip on their shoulder trying to get a message through. You need the allies. And when people think, well, I'm not homophobic, I'm not racist, well, please prove it, because it does get very tiring for other people having to stand up for themselves or explain to people why they shouldn't be an arsehole. It's not my job to convince you that I'm a human being.
Do you know, though, it kind of goes back to what we were saying about the COVID deniers. So until you're affected personally by homophobia, racism, inequality, discrimination, either yourself or your loved ones, you never truly understand the impact of others' actions. Now, if you know, when you say, oh, how would you feel if someone done that to your sister or your mum or, you know, your niece or your nephew? When you start to personalise situations, people start to think a little bit differently. And then the other thing is when you relate it to something that means something to them. So they think, you know, I'm going to call that person because I think they've got a different sexual orientation to me, or I think they're lesbian, or I think they're gay.
Which is weird, actually, coming from a straight man, isn't it? Because we're kind of the same.
But for me, it's like it obviously says so much more about that person than you. But it's when you relate it back to them, or when they relate to an experience that, you know, they think, actually, that could have been my sister, that could have been my mum that's just been heckled or shouted at in the street. I mean, it's absolutely, it's nonsensical, but it's hilarious. It's a non-comprehensible for someone like me or you to think that people think that's just an acceptable thing to do, and it's an acceptable way to treat someone. And so this is about your morals and integrity. And you know what? I think sometimes one of the hardest things when you're a decent human being is you then put your own morals, ethics, beliefs on other people and expect them to have the same. And that's when you get let down. If you walk around your own life thinking everyone's going to be nice to you because you would never do that to anyone else, that's when it gets you, when you get the, hey, you're lesbian, down the street, you think, oh God, why would they even say that to us? It's, you know, but it's almost like, you know, as I've got a couple of great gay friends who are they, you know, self-proclaimed in the closet for years until they had their first job, and they came out at work one day after the most terrible situation and walked in the next day in hot pants and a little vest, you know, like Freddie Mercury style, in heels, and he was just like, that's I'm loud, proud. And he's just ever since then just been, you know, just lived his best life, and he's prepared every single day for homophobic comic, and that's what he says he's ready for it, he's prepared for it, so he can snap it back, and he's just so much more confident in himself. But I'm like, isn't that sad that you have to live your life like that you're waiting for it? And he said, I'm just prepared. It's just the way it is in our society. He says, in 50 years time, it might not be like that, where it's just accepted, where we'll be using pronouns that people want, or will be what default is they, them, rather than that presuming someone's gender identity based on what they look like or the colour that they wear. You know, I just think, we're all so far. So for him, he's just about survival. It's about the survival in this moment in time, a damage limitation to himself because he doesn't fit a societal norm, and he's okay with that. And I'm just like, oh.
But the problem with that is that there's so much shame surrounding the situation.
It's been allowed to be your authentic self. That's what it's about, isn't it? And when we oppress people and when they can't be their authentic self, we know that they don't perform as well, we don't know that they're not happy, we know that they will have, you know, more sickness. It's so creating a culture of psychological safety combined with a culture of inclusivity. So, but to do that, you need to be transparent and able to give you some examples that I'm not ashamed to say about my own organisation. Well, I'm very ashamed, but I'm confident to say is that we have members of the staff who can't be out in our organisation. So I'm vice chair of our LGBTQIA+ network, which has only just been formed, can you believe, not long ago. And because of the fear of how certain patients will, and staff colleagues will react to them. And that to me is absolute, in 2021 is soul destroying for me. So it's like, how can we work together to change the culture in an organisation where people feel included and valued and feel like they can be their authentic self? Now, the thing about sexual orientation, people say to me as well, people don't have to disclose it and they can hide it and it doesn't have to be obvious. And like, no, it's not that. It's about the questioning. It's about being able to not want to, you know, trip yourself up at work when people say, oh, did you go out last night and you went out with your girlfriend or your boyfriend or your partner? And people then questioning you. You don't want to have to lie. People ask you direct questions. And I think that, again, that psychological cognitive load of not being your authentic self is something that when someone lives in a heteronormative environment in society where they're fully accepted, people just won't understand that. And that for me is why driving for equality, inequality isn't always equity either. You know, it's that's where we'll have to go from here, and it's everyone's responsibility, isn't it? I think that's the thing. When it becomes, you know, everyone's responsibility means no one's responsibility because no one takes ownership. But if everyone takes an ownership of something, then it becomes everyone's responsibility.
Yeah, absolutely. Yeah, and that does bring us full circle back to COVID, because it's exactly the same as wear your mask. It's not for you, it's the person walking past you at the supermarket or stood next to you. Just don't be a dick. I say this almost at the end of every podcast. Just don't be a dick. Be nice to other people, think about other people, and don't judge.
But you know why people are dicks? Because they've got privilege. And in Britain, in England, in the UK, we are born with privilege. And when people don't understand their privilege or they're not grateful for their privilege, they abuse their privilege. And these people that don't wear masks because they think that they're either invincible, they don't believe that COVID, it doesn't fucking matter. You've been told to wear your mask, wear your mask.
Yeah.
You know, we queue. We're a nation that queues. You know, like, it's simple to wear your mask. When people have control taken off them in their lives, okay, then they want to get control. We see this in critical care, okay? So when you have someone who is paralysed, either temporarily or they, you know, heaven forbid, to have a spinal cord injury, the only thing they have control over sometimes is how we can wean them off the ventilator and how we get them to breathe again. And you see some of these behaviour changes in people who have zero control in their life. So with people who, you know, with some of the COVID deniers that we've interacted with on Twitter and social media, you know, they feel like their privilege is to live their life how they want to do because they're in a society that enables them to do that, and they're grown up and they're adults and they earn their own money. But actually, that's not what a society is it? That's not what a community of people do.
Community is the word, yeah.
Look after each other, and they have shared values and they have shared beliefs. But this is friendship groups, isn't it? This is, you surround yourself by people who have the same common goals, ethics, values. What you can't do is translate that across a country, but that's what Boris rightly did eventually, lock we down with the same rules for everyone. But when you don't have that shared belief system, that's why the blanket rules don't work. Now, the enforcement of the rules hasn't been effective, but it's really hard because I've been on the trains, you know, I've been commuting throughout national lockdown. The police get on the trains, they're amazing. The transport police get on, they're amazing. The train staff are incredible. And bigging up LNER, incredible. You know, I couldn't have done my job without trained people. And you know, whose job is it at the end of the day? I mean, I carry masks around me, surgical masks, and try to give them out to people, and they get chucked off the train, but they'll just wait for the next one. So it's like, you know, it's impossible, isn't it? Yeah. That would be my take on why some people are dicks.
Yeah, some people are just dicks. Beppy said it at the end of the last episode. she was like, what did she say? She said, some people are shit, but you just don't have to bother with them, do you not? Just like, I don't like James Bond, so I don't watch it. And I was like, fair point, mate, fair point. I think we can all learn a
but
lot
would you
from
watch
that.
it? Would you watch it because your best mate likes it though? That's compromise. So that's this is when it becomes something you don't believe in, your belief system, but you're going to compromise for the greater good. And this is where it comes back to values, isn't it? Because what do you value more? So if your best mate wanted to watch James Bond,
I'm sure she would in this instance, but that's the case. It's compromising for the greater good, not keeping your mouth shut when your friend's being racist or homophobic. That's when you go, how, mate? Nah.
Yeah, absolutely. And you're quite right. So in that situation, if it's a big group of people and someone's shouting "Hoi lesbian" down the street, you maybe don't direct your anger to the person that shouted it. You direct it to the fella stood next to him and say, are you friends with someone like that? Is that who you're friends with? Is that what you believe? You're stood there saying nothing. And that's maybe another avenue, isn't it? Like you said, because you're not going to change that person who's, for whatever reason, shouting that down the street, but you might influence the person next to him, and then he might influence him. So it's about learning from each other, isn't it? And yeah,
it absolutely is. And hashtag being kind. Although I feel like that's been misused recently. I really do. I feel like that's a get out of jail free card at the minute.
Oh yeah, because there's being kind, but there's people being held to account, and you can hold people to account being compassionate, and it's not about being full of hate. It's about actually saying, is this the right decision you've made? Can you morally say that this is right? It's not about, you can have a different viewpoint from someone, and you can have a different opinion. It's how you put it across, but also the fact of people's different levels of justification, isn't it, when we'll talk about that. And that for me is the big, that's just, again, goes back to the nonsensical thing about why would you shout that down the street? Why would you think this is a normal behavior? And I think sometimes in these situations we see a very small snapshot of what people do and say, and you really do wonder whether they lie in their bed at night and think, actually, have I made the right decision? Is this right? Do I believe what I've just said there?
Everyone just needs to take responsibility for themselves, don't they? That's the key. Rachael, I feel like you're a Geordie Brené Brown.
A Geordie what?
Brené Brown.
Oh really? Oh my god, that's a compliment.
That's like the biggest compliment that I could possibly give.
Yes, I've never been called that before.
Well, there you go. You heard it here first.
Oh, wow, that's amazing.
Yeah, that's quite a tagline.
I can't say big words like her though. She says really big, long words. I'm not that clever.
You don't need big words. You've got the feeling behind them. You can probably change your Twitter bio to that if you want to later on. Speaking of which, tell us what your Twitter handle is, because then people can find you if they want to send you a message or ask you any questions.
So it's at AHP Leader. So that's Allied Health Professional Leader. So Allied Health Professionals are all the people like physios, speeches, dietitian, OTs. So we are collectively known as Allied Health Professionals. So yes, AHP Leader. And if you go onto YouTube and you want to see any of that stuff, we've also done a really good series on COVID, which is like, breathing problems and things. So if there is any healthcare students listening, or any exercise physiologists or any exercise technicians that want to know a little bit more, it's just all free access. Just get on there if you want.
Amazing. I feel like we could have spent twice as long picking up part of the patriarchy, so we should maybe do this again sometime, because we could definitely go down the other avenues too. But it's been really, really interesting talking to you, Rachael. Thank you so much.
Yes, you too. And just honestly keep up the good work. You're doing such an amazing job. I'm going to signpost people to your podcast. And if you do want me, friend, the Fanny Physio on, let us know, because she can talk to you about pelvic. Yeah, I mean, she can tell you how to have like 10-minute orgasms. I mean,
Right, well, she's going to be the next guest. I've written down gusset grippers. I'm going to tweet her as soon as I get off here. Just going to write down 10-minute orgasms.
Yeah, apparently by yourself as well. Even better.
Well, I mean, it's lockdown, people. What else have you got to do? That's better than the South Shields ferry, isn't it?
In a hip flask.
Yeah, we'll message her. Fantastic. Right, thank you, Rachael. Rachel's actually going back to work on the front line. This was her break that we've taken up here, so I do really appreciate it. And I hope that if anybody has anything to say, wants to say nice things to Rachael, please drop one of us a message and let us know. It's really nice to hear.
Thank you so much.
Thank you, Rachael. Bye-bye.
If you want to improve your well-being in a non-wanky way, you can join hundreds of other like-minded people in my monthly subscription group for live training sessions, daily workouts, nutrition tips, meditations, and more. Only $10 a month. Email me now, georgina@georginahalltraining.com. Thank you for listening to the Phemale Empowered Podcast. If you want to hear more from us, you can follow us on Instagram @Phemale Empowered, where you can also get involved with our discussions and feel free to send us a message.